In terms of how young is too young for cosmetic surgery, I mean, I operate on children sometimes. You know, the young child that's getting bullied at school because their ears stick out. I've actually had my ears done, so I get it. Like, I understand that if your ears stick out a lot, it can affect your self-confidence.
Ears are mostly grown at 5 years of age, and before people are starting to be teased about their ears when they go to kindergarten or first grade or whatever, which is a cosmetic issue. But it's a substantial, life-altering, surgery as well.
We operate on teenagers sometimes. A teenager with a big nose and a weak chin suffers just as much as someone with a bad scar on their face. And so when parents bring me their children, I go, what's the right thing to do for the spirit of the child?
With regard to breast, I have not seen someone that's a late teenager that was coming in to request cosmetic surgery that didn't really need it for reasons of profound asymmetry. When we're talking a D cup on one side and maybe no breast development on the other side at all. I mean, imagine that person going into the gym, or their friends are starting to develop and they're not.
It's very individual, and when it's done right, boy, it is life-changing. It's really wonderful, really wonderful. Your nose stays changed. Your chin stays implanted, your breasts stay enlarged.
Kind of the next level is it's very common, I should say, in the early teen years for a rhinoplasty. The nose is pretty much done growing. It's a time when you can do it without altering it, beyond what the face is going to grow into, and not have that issue be there for longer than you want it or need it to be.
People don't, in general, want to have plastic surgery unless they really have a problem. There's not too young of an age for cosmetic surgery, as long as the patient's mentally ready and their family understands the risks as well, the recovery process.